Hi, my name is Dr. Jennifer Song. I'm a board-certified dermatologist and clinical researcher at Southern California Dermatology and clinical faculty at Harbor, University of California, Los Angeles. Highlights for me this year is Icotyde. It's the first oral peptide that targets IL-23, and it's approved in both adolescents and adults for plaque psoriasis. What makes it so exciting is it's the first oral that has biologic-like efficacy. And what I mean by that is that generally in my personal practice, if a patient is comfortable with a biologic, because our biologics these days have great efficacy balanced with excellent safety, I'm usually encouraging and prescribing biologics. However, this is the first oral I have found to have high efficacy balanced with excellent safety. I have not seen an oral that has safety that shows that the placebo rates are similar to active drug. And that's amazing. And that does require a little bit of luck because I've been doing clinical trials for 20 years. So a really amazing addition to our psoriasis toolbox, having this oral drug to give access to more patients who may have been hesitant to start a biologic because of the perception is that these drugs can be more invasive or be immunosuppressive. So for me, when I'm asking patients about what is your goal, often I get the question like, I want to clear my psoriasis, but I don't want to kill my immune system. So with Icotyde, you can confidently tell a patient, wow, we don't even see increased risk of upper respiratory tract infections. On top of that, you aren't required to do TB testing or any laboratory testing prior to the initiation of this medication. Now, in practical terms, many of our psoriasis patients have comorbidities. So I want to be sure that they're healthy before starting a medication because maybe they have not seen another healthcare provider. So I am asking, have you had your annual health exam with your primary care? Or I'm okay with ordering some screening labs because I want to know if they have diabetes or high cholesterol. So when I'm doing it, it's because I want to know if the patient has other comorbidities associated with psoriasis, because I really believe in an integrative approach to treating our patients with psoriatic disease. Furthermore, this year, some other exciting developments for our pediatric patients include approval for Tremfya and Skyrizi down to the age of 6 years old for moderate to severe plaque psoriasis, as well as Zoryve, so topical roflumilast, 0.3%, down to the age of 2 years old. So I think that is huge for our pediatric patients who have plaque psoriasis. You can imagine that having psoriasis at that age is really can be life-changing and hard for these kids. And so I really think that you have an opportunity to really change their life trajectory when you help them clear their skin. Because remember, teenagers just want to be normal and not noticed. And then the final thing is 2 oral medications to be on the lookout for are our next generation oral TYK2 inhibitors. One is zasocitinib and envudeucitinib. Their data was announced at the AAD this year. So 2 other options with excellent efficacy. And so far, safety looks good. And so we'll see how the FDA kind of interprets that information and see what we're looking forward to in terms of laboratory monitoring. The other exciting news this year is really the addition of GLPs to our psoriasis toolbox. And as I mentioned before, I really look at patients with psoriatic disease in an integrative approach. And we saw this year 2 publications in our psoriasis literature looking at the addition of GLPs to biologic treatment for patients who have moderate to severe plaque psoriasis and psoriatic arthritis. And this biologic that was studied in this trial was Taltz. And so they did 2 separate studies, one for moderate to severe plaque psoriasis for patients who have obesity, so defined by a BMI of greater than 30 or a BMI of greater than 28 with at least one comorbidity. And these patients had lifestyle and nutrition counseling at the same time. And what we saw for plaque psoriasis is that patients who had the addition of the GLP compared to Taltz alone had 40% 40% more improvement in their plaque psoriasis. And in the psoriatic arthritis patients, we saw an even bigger effect. Patients who had the addition of Taltz plus GLP had 60% more improvement in their psoriatic arthritis disease. So it really confirms the systemic nature of psoriatic inflammation, that when we're helping patients not only lose weight, or perhaps the GLPs are targeting inflammation directly on the immune cells, is that we're helping them decrease inflammation overall, thereby helping them manage their psoriatic disease better. So this is really exciting because so many of our patients with psoriatic disease have diabetes and cardiovascular disease. So essentially, GLPs are making them healthier as a whole. There's no doubt GLPs are transforming the management of chronic disease, not just in dermatology, but in all areas of medicine. So in my personal practice, often the conversation comes up when I'm asking a patient about, hey, have you had your routine health visit with your primary care doctor? Or I ask them about updates, any new medications. I'm asking about, hey, have you had any new joint pain or stiffness? Or when you wake up in the morning, have you noticed any new joint pains? And so I tell my patients, like, I'm asking you these questions because I'm wondering if the inflammation from your plaques or your skin has extended to other areas. And so when I tell my patients that ahead of time, it helps to understand, the patients start to understand that the inflammation of psoriasis isn't always just localized to the skin.